I am Jack Bauerle, head coach of the men and women's swimming team at the University of Georgia. I had a total knee replacement, and it was necessary because I was dragging my leg around for the last 5 years. It got to a point where I had to have it operated on no matter what. I had no ACL left, no cartilage left at all. I'm pretty active on my job. Basically, on the job, I'm walking up and down the deck. If there's a swim that's really good, like an American record, I'm probably running up and down on the deck. And then secondly, I'm kneeling down an awful lot, talking with the kids when they're in the water for practice. Activity-wise, quite active. Still play half court, but I also play a heck of a lot of tennis 5 to 6 times a week in the summer. And I also go on about 3 to 4 good surfing trips in Costa Rica, and I have to have knees on that because we get pounded. I had about 3 knee injuries starting back in 1975 with basketball. So I stopped playing basketball just a few years ago. It just took me 40 years to stop. So it was sort of cumulative, basically. Everywhere I went, I had to walk. And I had pain walking, not just running. I just wanted to get pain-free. I was at a place where I was in pain every day, and that got tiresome. I just said, look, let's just get it done. I'll do it now. And it was even in the middle of the season, and it still didn't cause any bump in my coaching or certainly the success of the team, more importantly. I chose St. Mary's for my knee replacement because they had the best reputation. And I'm not going to take a chance with anything. And I view it as there are great coaches and not so great coaches, and then there are great doctors and not so great doctors, so I knew they had the best doctors and the best place. But the thing that I think took me by surprise at St. Mary's was the treatment and the care while I was there. It was personal. I felt real good about the whole experience. Surgery went great. I'm better than I was before I had it. A lot better than even probably a year ago before I had it. So as far as the surgery, an absolute success. My knee right now feels better than it was 10 years ago. I can walk better. I can get out of a chair without pain. I can sit in an airplane without pain. And right now I can hit a tennis ball without pain, and it's only been 3 months. I would recommend St. Mary's to anyone I know, even those at Florida, Auburn, and all our SEC counterparts. But no, my experience at St. Mary's was perfect, and I would recommend it to anybody.